Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing a couple of care plans for imbalanced nutrition, less than body requirements. Nutritional imbalance occurs when there is an abnormal level in certain nutrients caused by a shortage or excess in supply. It is a significant health concern that can lead to serious diseases and can make underlying medical conditions worse. Imbalanced nutrition less than body requirements is a NANDA nursing diagnosis that specifically refers to a state where an individual experiences nutritional deficits due to either a shortage of nutrient supply or a higher metabolic demand. It can occur secondary to several illnesses such as anorexia, stress, and depression. It can also be caused by side effects from certain medications and or medical treatment. So we have about 5 or 6 free nursing care plans for this subject. The link to the article is down in the description below, but we'll go ahead and do one for dysphagia. So our nursing diagnosis would be imbalanced nutrition, less than body requirements, related to inability to ingest food, secondary to dysphagia as evidenced by weight loss and verbalization or documentation of inadequate caloric intake in food diary or intake and output monitoring. Our desired outcome would be that the patient will either regain normal swallowing capacity or be able to improve nutrition by tube feeding. He or she, the client, will also obtain understanding of food options to support nutrition supplementation. Intervention. Document patient's weight. Weigh the patient daily in the mornings. Rationale. Weight loss can be measured accurately with the patient's actual rate rather than by estimate. The patient's weight is also an ideal tool in assessment of a person's nutritional requirements. Intervention. Start the patient on a food diary to assess caloric intake. Rationale. A record of what the patient eats can help direct treatment. Intervention. Assess what the patient can safely eat and drink. Rationale. Patients with dysphagia may be able to tolerate thickened liquids and pureed food. Assessing what the patient can tolerate will help support nutrition and arrange food choices that become available. Intervention. Refer the patient to a dietitian and or a nutritionist. Rationale. A dietitian can help the medical team assess the patient's nutritional status and recommend food options that will supplement the patient's nutritional gaps. Intervention. Refer to speech or language therapy. Rationale. Speech and language therapists assess the patient's ability to swallow safely and can recommend food and food texture that is safe for the patient to eat or drink. Intervention. Weigh the patient regularly and document readings. Rationale. The patient's weight will help the evaluation of the patient's progress. Intervention. Explain nutrition and the patient's personal nutritional needs. Rationale. Understanding the importance of maintaining proper nutrition will encourage the patient to become more proactive in adhering to the treatment plan. Intervention. Discuss the nutritional recommendations of the team, meaning the nutritionist and dietitian, to the patient. Follow the recommended type of diet and thickness of fluids. Rationale. An explanation of new food choices and the recommended type of the diet and fluids to support the patient's nutritional requirements will promote compliance to the treatment. Okay, so now we'll go on to another nursing care plan, and this one will be uh, with someone with burns. The nursing diagnosis would be imbalanced nutrition, less than body requirements related to increased metabolic needs, secondary to burns as evidenced by severe burn injuries, muscle wasting, and weight loss. Our desired outcome would be the patient will demonstrate adequate nutritional intake and meet metabolic needs as evidenced by weight gain. Intervention. Weigh the patient daily and document readings. Record the patient's food, choices, and drinks. Rationale. A record of the patient's weight will help assess the progress of the treatment. Creating a food diary can help monitor patient's progress as well as his or her likes and dislikes in terms of food and drink. Intervention. Encourage the family members to bring food from home. Rationale. Administering what the patient likes to eat can increase caloric intake and promote weight gain. Also, participation of the family members can help improve the patient's appetite. Intervention. Promote a conducive feeding environment. Rationale. The patient's environment can help induce appetite and promote intake of food. Intervention. Educate the patient about proper oral hygiene. Rationale. A clean mouth enhances the taste and promotes good appetite. Intervention. Refer the patient to a dietitian and/or nutritionist. Rationale. Dietitians can help in the assessment of the patient's nutritional status and nutritional needs. They can also recommend food to support nutritional gaps. Intervention. Administer supplemental nutrition through the insertion of a nasogastric tube or NG tube, or the administration of parental nutrition is indicated by the physician and is recommended by the dietitian team. Rationale: in cases where the throat has been affected or any part of the upper digestive system is impaired, as in maybe a burn patient, supplemental nutrition may be necessary. This concludes our talk regarding imbalanced nutrition. This is Nurse Anna saying thank you for listening, and please visit us at nursestudy.net where we have free care plans, practice exam, and study guides. Have a great week.